This lecture tries to help families with an ASD child by providing them some guidance about how to satisfy their needs and their child's in all these stages of life, facilitating for that purpose the access of parents to the resources and services they have at their disposal. To begin, I'm going to talk about the importance of counseling. This practice can help parents of a child on the spectrum because of the following reasons. The counseling can help in adjusting the parents to the diagnosis. Sometimes the diagnosis is traumatic for parents. However, understanding the stages of the grief and the characteristics of the ASD can help parents to accept their child's condition. Another reason is that the parent acquisition skills can also help to understand their child, the characteristics of the disorder, and as a consequence, this can lead to a more convenient intervention. Counseling can also benefit the couple. Sometimes, having a child with ASD could bring the couple numerous problems that can be solved by this kind of therapy. Guiding couples in creating new practical skills, like promoting communication effectively and empathically, or developing cooperative strategies around the child's behavior, for example, could be essential for strengthening the relationship. Being an ASD parent can be overwhelming sometimes, and a counselor can help by validating the parent's effort and encouraging them self-care skills. But not only the couple needs support, the whole family has the necessity of receiving support. So I'm going to talk now about the family-based intervention model, which purpose is turning the concerns into needs through 4 steps. The first step is to identify the needs of the family, to know what their personal concerns are. Then, it is essential to identify the family's resources and strengths. Only this way we can know what we need and we need to work on previously. The third step is identifying sources or networks of help so that families can count on them at any time. The last step is empowering and training families about ASD, since parents are the ones who know their children best and they are main supporters. An example of this model could be the following. The concern of a family is that their child is always late for school because his son has so many tantrums in the morning. This concern can be transformed into a necessity of an intervention program on daily routines. Once parents have received the training, it is possible that they will be able to cope with the situation by themselves. By giving the family the skills, strategies, and resources could solve the vast majority of their concerns. The main objectives of the family therapy are to inform about the characteristics of the disorder, for example, how the brain works in children with ASD, as the lack of central coherence they present or the difficulties in their executive functions. Another objective is to inform about implications at the family level. Parents should be informed about how having a child with ASD can affect their lives. For example, it is proved that they are more likely to suffer from anxiety, depression, stress, and so on. The family therapy also tries to guide the process of adaptation and family adjustment, like what are their roles in the family or what can be expected from their children in a realistic way. Another goal is to teach parents strategies for dealing with their child's behavior and create and maintain a social support network that parents can use whenever they need it. All of these aims try to prevent the appearance of chronic stress, which is quite common. But we must bear in mind that there are other family members that need to be taken into consideration, such as the siblings. Having a sibling with ASD has some effects that must be considered. For example, the siblings of an ASD child can consider that he or she is less loved or that their parents pay much more attention to his or her brother or sister. Sometimes they also can feel that they have to fulfill more responsibilities and rules than his or her sibling. So it is important not to overload them. Besides, in many cases, due to the influence of the parent's stress. Another problem that they can encounter is simply by having a sibling with a disability. Unfortunately, our society is not prepared yet for such situations, and the stigma that nowadays still implies having a sibling with ASD. And the last but not least effect is that parents have to be aware that they are models. Consequently, the sibling without ASD will act the same way as their parents do. To sum up, the greater the severity of disability is, the more easy to identify, and as a consequence, less effect to the siblings. On the other hand, the more conduct disorders are, the more affectation of siblings will be. Once we will know how a child with ASD has a big effect on the family by changing the typical roles, making it more prone to suffer anxiety, depression, or stress, I'm going to provide some tips for its role in the family, starting for the parents. Parents should master how to be the best advocate for their child's rights. They must be prepared to fight fiercely in order to defend their child's rights. Parents are human beings, so they have feelings and they do not have to hide them or reject them. Instead of that, it is important to talk about them and try to receive some kind of support, or just have the feeling to be heard and unburden yourself. Another tip is do not let autism consume every hour of your day. As I have just said, you are human beings, so you have to satisfy some personal and social necessities. So you have to look for devoting time for yourselves. Remember, the only way of caring others is to care yourself first. All the small goals achieved must be appreciated and rewarded with a smile or care aside. Most times, those achievements are a consequence of a great effort from the children. So, if we appreciate them, we are motivating them in trying and do not surrender when a difficulty appears. A good advice for parents is that they must get involved with the autistic community to know the services they can need, to be informed about the most effective interventions, or just to ask when encountering a problematic situation. Now I'm going to talk about some tips for the siblings. All the families have their challenges, and they have to cope with daily problematic situations. So remember, you are not alone. You can share your problems with your family or friends. Do not hide your feelings. Another one is you have to be proud of your sibling. Talk about him or her. We all are different, and the more knowledge people have about different disorders, the more acceptance of them we'll have. Remember also that anger will not help you help you feel better or resolve the situation. So you try to develop other skills that let you know better how to deal with those problems. Find time for yourself and your parents and do activities that you enjoy all together. Lastly, find an activity that you can share with your sibling. Now it's time to give some advice for grandparents and relatives, such as seek support if you need it, talk about it. Again, it is important to point out that the feelings must be expressed, not hidden. Be aware that you are helping in the caring of the child. You can give your opinion and support, but do not judge or compare children. The most important issue is the respect for what others are doing, because they probably are trying to do their best. Learn about autism. The more you know, the better you can intervene. And dedicate a special time to do an activity with him or with her and establish a close relationship with him or her, giving the support they need. And to conclude, there are some reflections we cannot forget. Each family is unique, with its personal characteristics, specific needs, etc. Respect the cultural identity of families. Do not criticize because you don't know the specific situation of the family. Take advantage of the strengths and natural support networks. And to conclude, be aware that autism affects the whole family. That's the most important thing.